Hi, I'm Dr. Bill Sulkowski. The name of the program is Let's Talk Dentistry. I'm a general dentist with an office in Canonsburg. My special guest today is Dr. Mark Bozzato, and we are going to, Dr. Bozzato is a general dentist also. Nice thing about general dentistry is you can do most phases of dentistry and specialize in certain areas without calling yourself a specialist. Some people like to do crown and bridge, like to do periodontics, like to do orthodontics, like to do holistic general kind of biologic dentistry. And so that's the nice thing about it. You don't have to just do braces all the time, which for me would, I guess, be a little boring. But so this is a continuation of the last program we had, and I appreciate the fact that Dr. Bozzato is here because he brings to the table a perspective, and the nature of my program is to tell people about dentistry and the different phases of dentistry and the different opportunities out there. And there is an absolute greater correlation by the day, by the hour, by the day, by the week, that there is if you have healthy gums and teeth, you have a healthy body. They are absolutely the oldest people in my practice that are the healthiest, have healthy teeth and gums, and there is an incredible strong correlation. Having said that, and I want to introduce Dr. Bozzato again and have him talk about biologic dentistry and how it might be different from general dentistry, and how it helps people, something about the philosophy and how you integrate that with dentistry and the overall well-being of the individual health-wise.
Okay, thanks for having me back, Bill. Biologic dentistry, to a large extent, takes what a generalist does traditionally and then overlays more of a whole body holistic component to it. We look at addressing more closely the part of the equation that equals health that has to deal with treating from the inside out. The traditional approach is you treat from the outside in. You lower the bacterial populations. You go in there and take out decayed tissue. From the outside, you go and you take out. The holistic biologic approach is that, plus you make the host, in this case our patient, more resistant to the disease. And you do that by looking at nutritional gaps, and you do that by being careful with the types of materials that you may use, because there's a spectrum of or a strata of how biocompatible something may be for somebody as opposed to someone else. Now, let me say right now that there are many, many people out there, and the vast majority, they don't have necessarily symptoms because of materials. But we live in a toxic environment. And I think what our future research is going to continue to bear out is as this toxic load increases, that symptoms are going to increase. And it's going to become more challenging to figure out what's going on with the body. Now, I like the position that we dentists are in because we're looking at the window of the body's health. A couple things I do differently diagnostically has to do exactly and specifically with biocompatibility, and it's called a blood biocompatibility.
Before we get into that, Mark, I wanted to kind of do some tie-ins with the overall health. When I first started dentistry, they the philosophy was you treat the mouth and its relationship to certain systemic diseases like diabetes or heart disease, and you said, well, you treat separately. Now, what I'm finding out, I'm getting referrals from heart doctors, cardiologists. I'm getting referrals from people who have kidney problems from their physicians, and they're understanding the total scope and how the mouth affects overall health, and they're wanting to clear up these issues of why the gum disease or the prolific cavities that some people are getting, or the amount of bacteria in that people have in their mouth. And one of the things I always say is that some people come in and they say, "Hey, my gums bleed all the time," and I say, "Well, that's not normal." I said, the bacteria that is in your mouth and in your digestive tract is meant to be just there. When your gums bleed, there's a conduit for this bacteria to then get into your bloodstream. And once it gets into your bloodstream, it raises different markers for inflammation and for overall systemic health problems. And so the holistic approach to dentistry, which I think dentistry has been further ahead of the game than physicians, because we've talked about prevention and done prevention from the get-go. Brushing, flossing, getting your teeth cleaned regularly before the presence of disease, and or correcting situations. But I still get people in the office who say, "My gums always bleed." They think that's normal. Well, there are ways to correct that. There's tie-ins between with pregnancy problems, with bleeding gums, not just the ramifications of being pregnant, but the ramifications of bleeding gums before you get pregnant, that kind of thing, and during the pregnancy, with diabetes, with certain brain disorders, kidney disorders. So there is a greater approach towards holistic dentistry, biologic dentistry, by the minute. So this is a very appropriate program to be having at this point. So we are going to take a break now, and we're going to get back to the diagnosis, some of the ways that Dr. Bozzato would diagnose for the biologic dentistry. So we'll be back shortly and pick up the conversation. I'm Dr. Bill Sulkowski, along with Dr. Mark Bozzato. Thank you.
The fight against arthritis isn't a walk in the park, but it's a start. Arthritis affects 66 million adults
and 300,000 kids like me. I'm Patrick, and I have juvenile arthritis. Walking for me can be a struggle, but I don't have to walk alone.
Join an arthritis walk team in your community today to help the Arthritis Foundation improve lives and find a cure. For more information, visit arthritis.org.
Do you think you'd notice if you were missing half of your money, or half of your friends, your better half, your half and half? What if you were missing half of your kidney function? You'd think you'd notice, but you could have chronic kidney disease right now and not even know it. According to the National Kidney Foundation, 20 million people have chronic kidney disease, and 20 million more may be at risk and not even know it. Chronic kidney disease is a growing epidemic. Anyone with high blood pressure, diabetes, or a family history of chronic kidney disease is at risk. Certain ethnic groups are at an even higher risk. Early diagnosis and treatment of this disease and its complications are vitally important. To get the whole story on chronic kidney disease, talk to your doctor and visit the National Kidney Foundation at kidney.org or call 1-800-622-9010 for a free brochure. Because when it comes to chronic kidney disease, you might not know the half of it.
So, you feel tired? You've put on some weight? Your joints hurt? Well, you're getting older. But there's some simple things we can do to keep you happy and healthy for years to come. Proper nutrition, less treats, a basic exercise plan, lots of walks and fresh air, and see me for twice yearly checkups. Now, how does that sound? Good boy.
Improve the quality of life for your elderly pet. A message from the veterinary members of the American Animal Hospital Association.
acidophilus.
Yeah, well, hi, welcome back. I'm Dr. Bill Sulkowski. The program's Let's Talk Dentistry, and my special guest is Dr. Mark Bozzato. We're talking about biologic dentistry, and now I'm going to turn the program over to the doctor, and would you take it from here and talk about diagnosis? And
Well, thank you, Bill. I guess where we want to start, if we could put up slide number 3. This goes to the heart of what you were saying before the break that has to do with periodontal disease and its impact on systemic health. And you can read all of the issues, all of the tie-ins to general health. And the reason this is, it has to do with bacteria, which can create a whole body infection, which is known as a septicemia or a bacteremia. Now, if we could look at slide 7, and this slide shows the bacteria associated with a periodontally involved tooth. Now, there's a lot of gunk associated with this tooth, and you get a chronic inflammatory response. And Bill, you know from the most recent research that they're proving that chronic inflammation is leading to things even like pancreatic cancer, because it's taxing the immune systems in ways that medical researchers can't possibly fathom yet, but they're gaining on the information. And what's most important to the audience is you look at those green spheres and those purple spheres and just see a big blood field there, because the blood is sending all these soldiers there to try to fight this infection. And the blood is taking up this infection and trying to contain it. And this blood is heading for the heart. Now, if we could take a look at slide 8. Before we get to the heart, this shows an artistic schematic of the plaque layer. And what you don't see is that there's a fluid flow between the legs of this organic matrix. What you're looking at, and the tooth surface is right at the bottom, and then the pellicle is the sticky interface that the bacteria collect to. What we're looking at is a sophisticated population of a living organism that doesn't want to be killed. And what we're trying to do in dentistry, and what patients should be trying to do every day at home, is mechanically removing that by brushing and flossing. Those that cannot successfully do that will wind up with some level of periodontal disease. 75% of the population has some form of this. And it leads to bone loss, tooth loss, and then all of these systemic diseases that we've alluded to earlier. Now, one of the tests that I do to help treat this is a saliva pH test. It's important to know whether or not the body's environment is acid or base. The pH scale is 0 to 14. The neutral number is 7. Anything below 7 is acid. Anything more than 7 is base. Now, if we could look at slide 1. Because now we have the blood taking all the gunk away from the area, and if the blood is acid, if the saliva is acid, the blood is acid. The body is acid. And what we're looking at is a dark-filled microscopic view of red blood cells that are stuck together. These red blood cells are supposed to be carrying oxygen, and they're clumped together almost to protect themselves from the acid environment. And what you can't see is that the back of that ground of that field is loaded with bacteria. And these are the bacteria that have been shown via research to cling to the coronary arteries. And they're going everywhere. To just right of center is a very dark glomp of something. That's a white blood cell. And that's an inactive white blood cell. The reason there's so many bacteria in the blood is because there's not enough white blood cells to do their job and gobble them up, and they're also not energetic enough to do it. If we go to slide 2, When the blood becomes basic, and this patient's blood became basic not by taking a pharmaceutical pill, but by taking a highly standardized juice product known as goji juice. This is a basic blood. The red blood cells are separated. There's movement there. They're taking the oxygen that the cells need to heal. I'm talking about the gum tissue, which is the front line. There's less bacteria, although this sample isn't pristine, because now you can see still there's a lot of bacteria in the background. But the white blood cell is getting more detailed in its periphery, and it's able to gobble these things up. So knowing what our patient's pH is and if it is part of the solution of helping someone with periodontal disease. The other thing about about raising the pH of saliva is it serves as a better buffer at 7.2 than it would at 6.0.
You know, a little anecdotal story here. I have a patient who is lives in a township here, who is a environmental engineer, travels all over, and you know, I mentioned to him that he had these gums that weren't healthy, and you know, highly educated, master's and degree in this environmental engineering, dealt with toxic materials and environmental cleanup, and I was recommending a deep cleaning, an actual physical debridement of where that material that you showed on that slide, and he hesitated, and you know, I thought I wasn't doing a good enough job of educating. And then one day he came in for a consult, and I said, look, you got a toxic waste dump in your mouth, and you need it cleaned up. He scheduled and had it done.
He understood
His
that.
gums aren't bleeding anymore, and he has this part fixed. You know what I mean? There's so many unknowns out there. Dentistry isn't an unknown. We know how to correct some of these issues, and that's why I think it's very, very important, and I appreciate the fact that you're coming on the show, Dr. Bozzato, to further enlighten people in the area of dentistry. So we're going to take a break here, and we'll be back with Dr. Bozzato. I'm Dr. Sulkowski. We're talking about biologic dentistry and basically prevention of problems that start in the mouth that lead to systemic problems. So we'll be back shortly.
How far would you go to help someone? Would you go to the end of your driveway? Would you cross a street? Would you cross an ocean? Would you go if you could use your knowledge to teach someone? And in the process, maybe learn something yourself. Life is calling. How far will you go? Peace Corps.
Is how you're feeling inside keeping you from going outside? If chronic diarrhea, severe abdominal pain, or rectal bleeding are tying you to the bathroom, maybe it's serious, like Crohn's disease or ulcerative colitis. See a gastroenterologist. Early diagnosis can make treatment easier. Get on with your life. Get help. Get better. The Crohn's and Colitis Foundation of America. Dignity, hope, and one day, a cure. Contact us for a free information kit.
Sure, my neighbors Gene and Louise, they may be superheroes with superpowers, but that doesn't make them so super at saving energy and money. I mean, I like them and all, but when Gene uses that power vision to cook dinner?
Honey?
Or when Louise or Starbright tries to save a little on the lighting bill?
Mom, a little light?
I may not be able to harness the power of the elements, but I save significant cash and help the environment with appliances, electronics, and windows featuring the Energy Star label. And I improved my home energy efficiency with insulation. My thermostat? Watch this. I'm just kidding. It's programmable. I don't have to lift a finger to save on AC and heating.
Mom, Dad's making fun
So discover your own energy-saving superpowers. Go to ase.org/consumers.
Hi, Dr. Bill Sulkowski. Welcome back. The program's Let's Talk Dentistry. My special guest today is Dr. Mark Bozzato, and we're going to continue talking about biologic dentistry. Would you take over?
Okay, thanks again. What we just finished up talking about was periodontal disease, but another way of saying that was the entryway, the potential entryway of bacteria into the body. You know, the gums are a tissue known as mucosa. It's a mucosal barrier. It's a protective lining that is intended to keep bacteria out. The teeth are not looked at as a barrier. They're used to help us chew food so that we can absorb nutrients. But because of our modern day diet with the processed foods, the refined carbohydrates, the excessive sugars, the excessive intake of soda pop, our teeth, which is the densest tissue in the body, they can be damaged via tooth decay. And if we could put up slide 4, when the decay reaches the inside part of the tooth, the pulp, which is the nerve and blood supply, the bacteria has now found an entryway to the rest of the body. So the same systemic connections can occur via an infected tooth as could be the periodontal disease. So we have the exact same concerns. Now, how do we approach this? And we're looking with a very challenging thing, because if you look down at the root tips, you see all those horizontal offshoots from the main canal. And those are very challenging, if not impossible, to treat. And that's the reason why when a root canal was done, we can't possibly hope to sterilize that tooth. We're hoping to disinfect it to get the bacterial populations low enough so that the immune system can deal with anything that's remaining. And this is a greater good kind of treatment, because the only other option in this case would be to have that tooth extracted. The one thing I want to say about extracting the tooth, a holistic approach, is if this tooth was extracted by me, when that tooth came out, most of the periodontal ligament, which if you look at the bottom right where it's labeled, the ligament is what separates the root circumferentially from the bone. That's what cushions the teeth when we chew or clench or tap our teeth together. When the tooth is extracted, most of that ligament will stay attached to the bone. And in a situation where you either have an infected tooth where there's no hope of doing a root canal, or let's say it's a root canal that years later has failed, when I remove that tooth, I will also go back in at the same time and remove the ligament to make sure that any of the infected tissue that might be retained by that ligament is also removed. If we go to the next slide.
So, doctor, just to clarify that, let's say that a wisdom tooth has to be taken out, it's not infected. Do you also take the ligament out, or just?
In that case, I would not.
Just
That's a
when
great
there's
question.
an infection.
Yes.
I understand.
Yes.
Okay, very good.
And slide 5, this shows the cleaning out of the canal. And if we go to the next slide, and this is the filling of the canal. With mechanical endodontics these days, and with the solutions that we know to irrigate the canals with, disinfection has been improved tremendously, so that the long-term prognosis of root canals has been improved and extended.
I'm good at these anecdotal kind of messages. I know your dad was an administrator in a school district, a local school district, so was my dad. I had the advantage of having, I don't know whether you had, I have an uncle who's a dentist, and Dr. Bob Sulkowski. He's actually 90 years old, and he's distinguished in fact that he's worked on himself. He's done, I had him, he was in the office, I did a veneer, and the other two he had put on about 15 years ago himself. But that's another story. My dad, though, would refer patients to my uncle, people who said, hey, I don't just feel good. You know, I'm just a little sluggish, I'm run down, and their teeth would actually be, you know, decayed and rotted and abscessed and periodontal disease. They'd visit my uncle, and back in those days, you know, 40, 50 years ago, a lot of the procedures were extractions and dentures. You get out the, you know, the causative factors of these things, and their health improved tremendously. And I remember growing up, my dad would tell me these stories. So he knew about a correlation between overall health and well-being and the mouth. Now, it's one of those kind of things where one abscess is not going to, for the most part, if you're a healthy person, it's not going to put you in the hospital. But if you have 10 teeth, 3 teeth, massive gum disease, and there's all levels of gum disease, and gum disease doesn't hurt.
Right.
You know, that's the thing. You know, if you have a toothache, oh, I need something done. If your knee's sore, oh, I need something done. Sinus infection, you got this pressure. Gum disease, people don't, you know, until it's end stage, they don't want to, you know, they say it's not a problem. So I recommend people get in for a periodontal screening. I know you'd be available. I'm available. You know, there's plenty of great dentists around.
Yes.
People should automatically, if they're having any issues with their health, start off with a good comprehensive dental exam.
That's good advice.
And I want to thank Dr. Bozzato. It's always informative, it's always interesting. In fact, I find myself learning from some of the presentations that and some of the information that you have. And I want to thank you very much for showing up at the program. And hopefully we can have you back again here soon. Could you give continuing ed courses or credits?
See me after class.
This program is Let's Talk Dentistry. My special guest, Dr. Mark Bozzato. The last message for the day is don't brush and floss all your teeth, just the teeth you want to keep. Thank you very much.